Hello, I'm Dr. Ryan Powell from Pharmacare Compounding Pharmacy. Many people are interested in bioidentical hormones, but they have no idea where to start. Well, at Pharmacare Compounding Pharmacy, it has never been easier to start on bioidentical hormones. I'm going to walk you through the process step by step. There will be no surprises along the way. I think you will be very happy with the outcomes. At Pharmacare, we focus on the most cost-effective approach to therapy. Not all practices can say that. At Pharmacare, the first thing that we will have you do is a saliva test. There are a lot of different hormones that you can check on this test. But like I said, at Pharmacare, we are always focused on the most cost-effective therapy. So what we usually recommend is a Profile 1. A Profile 1 will work for men and women. A Profile 1 will check your estradiol, your progesterone, your DHEA, your testosterone, and a one-time cortisol reading. The combination of those results and the symptoms that you tell us will give us more than enough information to make recommendations to you and your physician. Now, if you want to test more hormones, if you want to test your thyroid, if you want to test your cortisol throughout the day, we can do all of that for you as well. But like I said, we are trying to take the most cost-effective approach as possible. And we feel like we can get you the same results on the cheapest test as we can the most expensive test. So what you will do on the day that you're going to do your saliva test, you are going to spit in a vial and fill it up about 3/4 way full with saliva. You will do this within 30 minutes of getting out of bed. You want to do this before you eat, before you drink, and before you brush your teeth. If you cannot do this all in one sitting, you can put it in the refrigerator and continue this the next morning until you have enough saliva. Once the test is complete, there will be some questions in the saliva test that you should fill out. This is going to include all your symptoms, your past medical history, etc. From there will be a prepaid UPS mailer in the package. You will put your saliva test in the package. You will take it to your local UPS store or ship station. The results will come back in about 14 days. From there, we will reach out to you and set up a time for us to have your consultation. During the consultation, we will go over your past medical history, the symptoms you are having, any concerns you may have, and what your goals are. After that, we will work with a physician to get you your medications. Many patients can actually use their own physician. As long as our physician is comfortable with working with us and our recommendations, there is no need to see a specialist. However, if your physician is uncomfortable or doesn't know a lot about bioidentical hormones, we can put you in touch with many great physicians throughout the area. We believe the physicians that we refer you to are the best of the best. We also believe that these physicians are very cost-effective as well. Many patients love the collaboration between us and their physician. Even though we can work with your regular physician, we may recommend that you try and work with one of the physicians that we recommend to you. The reason for this is we have a great relationship with these physicians. And these physicians will also listen to you. These physicians will change your therapy based upon how you feel, not just on your lab levels. Like we said about this being the most cost-effective approach to bioidentical hormones, and we do not charge for our time during the consultation. So for only $170, you will have all of our recommendations as well as your hormone levels. At Pharmacare, we certainly believe that this is the most cost-effective option to starting bioidentical hormones. We're not going to make you do thousands and thousands of dollars of tests just to get started. At Pharmacare Compounding Pharmacy, we believe in listening to the patient. During the consultation, we will lay out all your options in front of you. There will be numerous paths that we could take to balance your hormone levels. During your consultations at Pharmacare, we offer what we call a good, better, best approach. You could spend as little or as much as you would like. Most women will drastically benefit from just one prescription a month, and that prescription is progesterone. Most women will see drastic benefits with just this one hormone alone. The next step would be treating adrenal fatigue. Most of our patients are type A personality, which means they work a hard job, they have busy lives, they have bigger families, they have a lot of stress, and this stress can wear them down over time. So a lot of times when they have adrenal fatigue or adrenal insufficiency, that will also contribute to hormone imbalances. In closing, I would like to reiterate that starting bioidentical hormones has never been easier, and it has never been cheaper, to be frank. If you are interested in learning more, please search our website, please call our pharmacy, please reach out to us via email.